Right, guys, welcome back. This is the final question on the 2018 paper one. It is question 17, and we are ending on a 16 marker on the cognitive approach to treating depression. It is a discuss question, which means that you need strengths and limitations. As you can see in the plan box, I am going to be breaking down my outline into 3 sections. I've got my intro into the basic concept of CBT and what it attempts to do. I'm then going to talk about Beck's cognitive therapy, and I'm going to talk about Ellis's REBT. The reason I am going to talk about both of those separately is because the examiner's report at the time said that the answers that got the highest marks were the answers that successfully distinguished between different types of CBT. Okay, so we're going to say what CBT is, but then we're also going to make it clear that there are different types of CBT, and we're going to explain what those are. In terms of our evaluation section, I'm going to do 3 evaluation points. If you've got 4, then amazing. If you've got 2, then great. But 3, for me, is a nice sweet spot between having too much and not having enough. Okay, so we're going to have research support by March et al. We're then going to move on and talk about suitability of CBT for diverse clients. And then we are going to finish off on a limitation that looks at relapse rates. There is a counterpoint for the suitability of clients that you can use if you want, but obviously that would be an extra evaluation point, and I want to stick with 3. So here is the model essay. So paragraph number 1, my introduction. Okay, so CBT is a treatment for depression that aims to identify and challenge irrational thoughts, and we want to change those thoughts so that we can improve overall emotional well-being. We're then going to talk about Beck's cognitive therapy. So we have that little introduction sentence. There are 2 main types of CBT. You could put that in the first paragraph if you want to. But Beck's therapy focuses on identifying and challenging negative automatic thoughts, particularly those surrounding the negative triad, which is negative thoughts about the world, the self, and the future. Then we're going to talk a little bit about the techniques. So Beck uses techniques like thought diaries and hypothesis testing to help patients recognize and evaluate the accuracy of those thoughts by comparing them with real life evidence. Okay, you can use phrases like patient as scientist if you want there as well. But there's lots of different ways in which you can kind of explain it. The idea is that it helps patients or clients develop a more balanced thinking and reduce their feelings of hopelessness. Paragraph 3, we have REBT. So it's based on the ABC model, and the aim is to challenge irrational beliefs that have come from an activating event and that have led to negative consequences. Ellis very much uses disputing, such as logical disputing or empirical disputing, and make sure you explain a little bit what that is. And that is used to help patients develop more rational perspectives, leading to healthier emotional responses. So that is my outline. In terms of a word count there, you are on roughly 175 words, which is a nice amount for an outline for 6 marks. So moving on, we have the first evaluation point. It's a fairly big one. It's research support for the effectiveness of CBT by March et al. Okay, so we have this study of 327 adolescents who were diagnosed with depression, and they compared the effectiveness of CBT, antidepressants, and a combination of the 2. They found that antidepressants and CBT were equally effective. However, the combination therapy group had the most improvement of all of them, and that demonstrates the effectiveness of CBT in depression, and it also suggests that it works well alongside medication as a combination therapy to provide an even more effective treatment for people with depression. The second evaluation point is questions around the suitability for diverse clients. Okay, so the research here suggests that CBT is perhaps less appropriate for people who have very severe cases of depression, primarily because they might not be able to engage with the work that is required in the session, and it's also possible that certain types of learning difficulties might also not be best suited for CBT because there is quite a lot of cognitive work associated with the therapy. The limitation here is, of course, however, that CBT is not suitable for all clients and it can only be used for a certain type of client, okay, which is obviously a limitation because you want your therapy to be accessible to all. Okay, and then finally, we have questions around the long-term effectiveness. We have some research by Ali et al. From 2017, who found that 42% of clients relapsed within 6 months of ending treatments, and 53% relapsed within a year. And that suggests that CBT might need to be repeated periodically in order for the positive benefit to be maintained. And that is, of course, also a limitation because you don't want to have a booster effectively every 6 months or however long in order for your therapy to be effective. You want to be able to have your therapy for however long it takes and then be done with it. Okay, so there is some question there around the long-term effectiveness of CBT. Okay, and that is my final evaluation point and the final bit of that essay. Okay, I hope that's all made sense and I hope it's been useful. Any questions, please pop them in the comment section below and I will do my best to get back to you ASAP. Thank you very much for watching. I will see you in the next walkthrough. Thank you.